everybody. Welcome to Critical Mass 2015.
So every year, approximately 70,000 young adults are diagnosed with cancer. And that doesn't include people who are still in treatment or who are surviving long-term repercussions. There are very clear and unique differences in young adults, and we do not address those as a matter of course, just like you would address a child or a woman. We need to understand that young adults with cancer are different and they need to be accommodated in a certain way. The long-term repercussions of not addressing the needs of this population are bigger than probably anyone has considered in the past.
As a researcher, I always look to the research and say, what could we be doing and what could research be doing that would help address so many of these challenges? And at the root of it, we still don't necessarily know what best care looks like, what are best practices in this population, and how do we deliver them? There have been guidelines, there have been recommendations, and none of those have been thoroughly researched. They're primarily consensus-based. They're based on the small body of knowledge that already exists, but there is no huge data set that's telling us this is the best way to care for an AYA, and this is how to deliver that care. And so I think those are the two pieces sort of in the research world that we need to find a way to deliver. I think one of the solutions is legislative advocacy, and is advocacy in larger systems, the systems that could be leveraged to address these research questions, and to put some power behind those guidelines, meaning there has to be data to back them up, to say that this is the right thing to do, and there has to be a way to enforce, if you will, to actually get that care to be delivered in that way.
If you think about the successes that we've had over time by putting money and attention towards the needs of the pediatric cancer patient, which represents less than 1% of all cancer diagnoses, their survival rates have improved drastically. If you think about what we could do if we put the same level of attention and support to addressing the needs of young adult cancer patients, we could make a huge difference in their lives and in their outcome.
I come to this event wearing dueling hats. I'm both a survivor, I've been a caregiver, and then I'm also this advocacy. I have this advocacy position now from running an organization, and even in that kind of position, it's easy for me to forget that some of the issues that I struggle with are also some of the issues that lots of the people that all these wonderful people interact with struggle with too. And so these fears about conversations and communicating with a supporter and talking about death and dying and infertility and caregiving and things like that before it's too late. I internalize a lot of those problems and I deal with them on my own day-to-day, but just this global conversation about all of those elephants in the room is just really inspiring.
I think that's the strength of Critical Mass as it has evolved over the years, is this community and the strength of this shared vision.